Hi, if you're thinking of getting fit, be it through yoga, Pilates, gym exercises, or YouTube exercises, I'm going to give you a great tip that could save you from developing a lot of back pain. The problem with exercising and back pain is a little known muscle we call psoas. When we have a bone, people are aware of muscles on the front, in this case it's called bicep, and muscles on the behind side, which in this case it's called triceps. In exactly the same way, we also have muscles on the back of the spine here, and believe it or not, muscles on the front of the backbone here. Now this particular muscle is called psoas, and this is the root cause of certain types of exercises which relate to back pain. And it's the secret of this muscle is its anatomy. This muscle is attached to your lower back through all of the bones and takes some attachment from the discs at each level. The muscle then runs downwards and sidewards through the pelvis, through the groin, and anchors on to the leg bone. The significance of this is that if the muscle is anchored to the low back, it's clear you're going to be pulling on the low back. And over a period of time, that can weaken the spine and lead to back pain. As you can see in the following video, as psoas starts to contract, see how the legs start to raise. In exactly the same way, if psoas contracts, you can also do a sit-up. It's a popular misconception that doing these exercises will strengthen your stomach muscles. Of course they do to a point, but this is often at the expense of your spine. And that, of course, is how back pain injuries arise. So, what exactly is going wrong with psoas, and why is it such a troublemaker? As you can see here, I'm sitting, and this is what obviously we spend most of our lives doing when we're at work. So as a person sits for a length of time, you can understand that this area starts to shorten, this area starts to shorten, and also the elbows start to shorten. And that's the reason why when people stand up from sitting in old age, you often see them walking like this, because they cannot stretch up here and they can't stretch their elbows and they certainly can't stretch their knees. So you may ask, what can be done about lengthening the muscle called psoas? Because the key to having a healthy back is to keep psoas longer and supple and not contracted and tight. Because when tissues become tight, be it a chest muscle, a neck muscle, or even a low back muscle, that's exactly the time when you're at higher risk of an injury. So we're going to show you a few exercises in the following clips to give you an idea of what you can do to try and reverse the effects of lots of sitting. In this exercise, we bend the leg backwards to try and stretch out the front of the thigh, including the psoas as well as the quadriceps muscle. You can make the exercise stronger by slightly arching backward, but be careful not to pinch the low back. As you do this exercise, also be aware of the knee. Be careful not to pull the foot back too hard because that could aggravate an existing knee problem. So do this exercise carefully. In this exercise, stand by a solid surface such as a desk, hold on to it and swing your leg gently backwards and forwards. Try and stay as upright as possible, and particularly as the leg is swinging backwards, be careful not to pinch your low back. As the leg is swung forward, you may start to feel the hamstring stretching out. This exercise stretches the calf muscle. As you can see, the front foot is bent and the back foot is stretched out, but importantly, the heel is on the floor. As you lean into the wall, you should be able to feel the calf stretch. As with all stretching exercises, be careful how you stretch because a stretch could potentially lead to a strain. So stretch only to return the normal length, not to create new length.